Hello, everyone. Good afternoon. Oh, are we alive? Are we good? All right. Hello, everyone. Good afternoon. Welcome to the UWorld Nursing Live NCLEX Review Series. My name is Andrew, and this is Holly. We're both very excited to be with you here today. We will be your presenters as we go through the items that we have selected for you. For those of you joining us for the first time, we're very excited to have you. Thank you so much for being here. And we welcome back anyone who was here with us last week. Some of you may recognize Holly. We're going to go ahead and introduce ourselves again. And after we do that, we're going to go ahead and get going with the outline for today. So I'm Andrew. I'm a nurse content developer here at UWorld. I've been with UWorld for about 2 years. And I am currently a bedside nurse. I work in a med-surg floor, and I have been a med-surg nurse for a little over 4 years. I'll let Holly give a quick introduction, and like I said, we'll keep going.
So hi again for those of you who watched last week. My name is Holly, and I am also a nurse working in content development here at UWorld. I work in the bedside, or on the bedside, as a CVICU nurse, and we are so excited to be bringing you this again today. Last week, we just had such a great reception, so many comments and views, so excited to hear about that. And we're happy to let you know this week, based on your comments, based on your feedback, that we have kind of created some changes, some different things. Obviously, there's 2 of us up here today, but we're going to try to be a little more interactive with you. So you guys are going to have the opportunity to answer questions in between the items, as well as we'll try to take a little more from you comment-wise. So, that being said, Andrew, would you like to remind them about anything?
Definitely. So as we're going through today, I know there were some issues when it came to video quality. We want to make sure that if you would please take a second right now, check your video quality settings. We want you to we recommend at least 720p when you're viewing today. And if for whatever reason the live stream, you're having trouble getting it on your device, please refresh and hopefully it should come back up. And as we're going through this, if there's anything that you're seeing on your end as far as technical issues or difficulties, please feel free to leave them in the comments. We would like to know anything that may be going on there. So.
And we heard you from last week. We have zoomed in a lot, so we hope that helps you.
Absolutely.
So now that we talked about that, kind of want to talk about what we're going to be going through today with our questions. So this week we'll be talking about physiological adaptation, and these items make up about 14% of the questions that are on your NCLEX. And so it's really important that you know these, and I'll let Andrew tell you a little bit about the item types.
Definitely. So when it comes to the item types that you're going to see on the NCLEX, the NCLEX-PN has a test plan on their website that talks about these item types and these categories. And I believe we have linked the NCLEX-PN website for you to take a look at that. And that can be something that can help guide you as you're studying. So again, we're talking about questions dealing with physiological adaptation, which is a client needs category that's been put forth by the NCLEX-PN. It focuses a lot on med-surg type questions, especially those referring to chronic, acute, and emergent disease processes. So I'm not sure if we're missing anything, but if we're ready, I think we can go ahead and get started with our first item.
All right, so Andrew's going to be taking over the items, and I will be fielding your questions as well as chiming in here and there. So I will let him take over.
Wonderful. So just briefly, we're going to touch on kind of what this question is asking. We do want to get feedback from you all. Do we have the poll function able to answer for these students? We'd love for you guys to actually respond kind of like you did before in the chat, and we're working this week to see if the poll functionality is something that might be useful for us going forward. So this is a question about a client in the emergency department with diabetic ketoacidosis. And so after obtaining the client's blood glucose level, what prescription should the nurse implement first? So this is a priority type question, priority based. Diabetic ketoacidosis is a acute complication of a chronic condition being, of course, diabetes mellitus. So we're going to give you all a second to take a look at some of these answer choices, and if you all want to go ahead and answer.
So while you're looking at our answer choices here, we want to give you a little bit of a test-taking tip. And so in a question that we have like this, where we're asking about what would you do first, what would you prioritize, you want to think about which of these options would cause the most harm to your client if left undone. So we know if this client is in diabetic ketoacidosis, they're going to be having issues with blood sugar and fluid and electrolyte levels. So based on that is how we want to start looking for our answer. So I'll give you guys a second, and then we will pick our answer based on what you have to say.
All right. We getting some answers in?
It looks like it.
Perfect.
So
Okay.
I think we'll go ahead and answer. It looks like we've got about 68% of students answering with choice 1, so let's go with that.
Let's go ahead and pick it. Let's see. All right, awesome. And that is correct. So some feedback that we had from y'all last week, we want to make sure, obviously, that we're talking about the correct option choice and some of the incorrect options. So we're going to scroll down here. This table is something we'd like to maybe reference while we're fielding some questions at the end of this, just to talk about a little bit about the differences between DKA and HHS. So we will come back to that. So let's talk about this question. When it comes to diabetic ketoacidosis, the client has an abundance of blood glucose, right? There's a lot of sugar in the bloodstream, which leads to hyperglycemia. And one of the defining characteristics of diabetic ketoacidosis is they're going to diurese heavily. So all that you have this serum osmolality where all of the sugar is in the bloodstream and all the water is going to be pulled out, and that's going to cause the client to have a lot of fluid volume loss. So what that leads to, what that contributes to, is hypovolemic shock. We want y'all to take a quick look at this image here. Anytime you have a massive amount of fluid volume loss, you're not perfusing the vital organs as well. You need to have fluid volume replacement so that you can get oxygen to the rest of the body. So with diabetic ketoacidosis, this is a priority because we're losing all that fluid volume, and we need to make sure that that blood pressure is going to stay up and that we can maintain that blood pressure while we correct that hyperglycemia.
Absolutely.
Yes, which is, again, this is a reason why some of y'all may not have selected this answer choice. Y'all may have chosen the insulin. That comes, yes, insulin administration is a priority, but that's going to come a little bit further down the road. So let's talk about these incorrect option choices. So option 2 was talking about administering a long-acting subcutaneous insulin. This is going to be important more towards the point where we've stabilized the client, maybe towards where they are, on a floor recovering, looking at possibly discharging home. That's when we want to get that balance of administering these long-acting insulins. So that is not our priority at the moment. It will be in the future once we've stabilized them. Option 3, so again, I'm going to reiterate this, a continuous IV infusion of insulin. Yes, this is necessary. We want this to happen. We want to get there. However, something that's very interesting about insulin administration, if we are prioritizing that, something that insulin can do is actually draw water and potassium and glucose into the cells, which is great, but if we're not rehydrating, we could actually be making fluid and electrolyte problems worse.
Absolutely.
So we want to make sure that the first thing that we do is bolus them with some IV fluids, get some continuous IV fluids going, so then we can be concerned about the insulin administration. And our last option, option 4, very important, and don't get me wrong, like I said, this is important to happen during these, when you're taking care of somebody with DKA, you want to make sure that you're watching the potassium level. When you're administering insulin, before, during, and after administering insulin, you want to make sure that you're checking that potassium level, because that can lead to cardiac dysrhythmias if you're making the potassium go too low, go too high. So it is very important to watch and monitor. However, we haven't really given any indication, at least in our STEM, saying that there's any worry or concern at the moment about any cardiac complications. So priority is going to be that fluid administration.
Yeah, absolutely. And I think it's important to add on here too that when we give the fluid boluses, this is going to cause hemodilution. So that will definitely bring our blood sugar down a little bit, and will definitely cause a change in our potassium and other lab values. So it's important that once we've initiated that fluid, the bolus, and then typically some more maintenance fluid after that we recheck laboratory values and results and then go from there. And also important to note that, this client's going to continue to lose water, but if we can replace what's been lost, we'll help kind of get them back at their baseline. And then from there, as we can stabilize blood sugar and we can stabilize those different things, we know that we're going to have less excretion. So we're trying to get ahead of it and eventually, slow or stop that and get the blood sugar back under control. So.
Perfect, absolutely. So we've covered the question. We do, if y'all have any, we want to go ahead and take a moment to kind of field some of the questions that y'all may have about this particular item. While we're getting some of that in, let's just talk a little bit. I'd love to show you a little bit more about kind of the function and usability of our platform. We love using our explanation to really go through these rationales, and sorry, I know hopefully me scrolling up and down isn't messing with any of y'all's images, so let me get to this, but we like including as many images as possible. Some things may stick out to you, it might help you remember certain things. We always use our explanation followed by our rationales, and then definitely always want to highlight our correct versus incorrect options. And at the very end, we have something called our educational objective. Great little summary that you can use, especially when you're studying. And this is actually great. You can put this in our notebook or our flashcards, which I can go ahead and show y'all now. So if I go ahead and highlight this, put this in a, let's see, let's put this as a notebook entry. So I'm going to create a new note. And I'm going to add the content right there, and there you go. So this is just kind of a general note that I want to have about DKA. It's a great summary, and knowing that I want to prioritize fluid administration moving forward. So just a fun little feature that we have.
So it looks like we have some questions coming in here. We'll scroll back up to this table. So we'll look at our table, and sorry, it's a little, in an effort to be big for you guys, kind of two questions. One, I know you guys wanted us to go over it, and also seeing some questions about HHS. We know this can have some different names. And we've mentioned at the bottom of the table, we know it goes by multiple, and so this is the most common. We do have another one listed. But a question we saw is, would fluid administration be the first for that as well? And the answer is yes, because we are going to be losing a lot of sodium and a lot of water, and we need to replace it. It's the same concept that increase in blood sugar is going to cause a lot of osmotic diuresis and going to dehydrate them. And so I'll just go through the table really quickly here. In a client without diabetes, we're going to look at our plasma glucose probably between 70 and 110. And with DKA, we're going to be greater than 250. With HHS, we're greater than 600, which is obviously getting pretty up there. Our arterial pH will be changing in both. As you can see, one's going to be going up, one's going to be going down. And if you can...
Now, why would it be going down with diabetic ketoacidosis? That's going to be because of the breakdown in the fat, the metabolism, going to lead to ketoacidosis due to the ketones that are present in the bloodstream. So that's something important to remember. And it's also a diagnostic feature when it comes to DKA. You're going to see those serum ketones or urine ketones when it comes to diabetic ketoacidosis.
Yes, and then the other question we will take on here before we go to the next, and sorry, I'm looking over here at our questions. I see a question about IV insulin in terms of potassium administration and how those work together. This is going to be probably a little more dependent on your specific facility, but as a rule of thumb, we are going to pretty much replace potassium on these clients sooner than later. So we probably around 4 or so, again, depending on your facility specifically, we'll start replacing because we are going to have a lot more potassium loss at the serum level with the rapid insulin administration. So we are going to now go ahead and move on to our next question.
Let's go for it. All right. Cool. So next question. This is a question about a 10-year-old client with who has cystic fibrosis, and the nurse has provided teaching regarding how to care for this client at home. And so what it's asking is, which of the following statements by the parent indicates that this teaching has been effective? And I'm going to scroll down so that you all can see this. Hopefully, well, let me try and make sure everything's in there so y'all can see the options in the question. There we go. Little tight, but if y'all want to take a minute, take a look at some of these option choices. We have things, option 1 is regarding chest physiotherapy. Option 2, administration of pancreatic enzymes. Option 3, increasing salt and fluid intake. Option 4, looks like adding a diet change. And option 5 is has to do with physical activity for this client. So I'll give you all a couple of minutes.
So we won't be using the poll feature on this one. We'll just have you guys type in the numbers that you think, and we'll go based on those. So again, this is a SATA, so we'll have multiple correct here. And a little tip for you in this one. So this is a teaching question, and especially here seeing that we have different statements, it's important for us to look at the statements and basically identify what is the teaching point of the disease process, of the care, or whatever it is, within each option. And then from there, determine, is this a true or false statement about that teaching point? So for example, the first question, our big teaching point, is chest physiotherapy. So true or false, we would do chest physiotherapy when respiratory symptoms worsen. So taking that approach and going through your items is big, but again, just identifying what that teaching point is within your options. So we are getting, my goodness, a lot of comments.
Quite a few.
So I'm gonna say, looks like 2, 3, and 4 are what I'm seeing the most of from our students. So
Primarily.
if you'd like to go ahead and answer that.
Sounds good. And real quick before I submit, you can also, something that we can do in our system here is we can cross out some of the option choices that we do not think are correct. So let's go ahead and submit that. Wonderful. 2, 3, and 4 were our correct option choices.
Good job, guys.
Very good. So I'm going to touch a little bit about the disease process of cystic fibrosis, and then we're going to jump into why that pertains to each one of these option choices. So let's go ahead and pull up this image here. So this is our client with cystic fibrosis, and it is a genetic disorder that leads to the mutation in a protein in the epithelial cells of the body. And those can be found in a number of different places. They're found in the sweat glands, they're found in the they're found in the lungs, the pancreas, the liver, the intestine. They're found in a number of different places. And based on where those epithelial cells are, different things occur. So let's go ahead and talk about what is actually happening. So let's talk about our second, let's go through the correct options first, right? So we're gonna jump around and do our explanation based off of what the option choices are saying. So option 2, which is the first correct answer, deals with administering pancreatic enzymes and when to administer those pancreatic enzymes. Within the pancreas, the epithelial cells are located in the gland, and that is where the pancreatic enzymes are needing to be released from in order to get into the intestine so that they can digest food properly. So with cystic fibrosis, those glands become obstructed with this very thick mucus, and that mucus comes about because there's a deficiency with the sodium and chloride channels that are present within those epithelial cells. So that thick mucus is going to block those pancreatic enzymes, and it's not going to allow for very adequate digestion of food. So these clients will need pancreatic enzymes, and it's very important to administer those pancreatic enzymes with food so that the fats, the proteins, the macronutrients, everything that's there can be digested properly and be absorbed properly. Mm-hmm. Along those same lines, because there are epithelial cells in the intestine, and they are also having some difficulty when it comes to mucus buildup and absorption, we want to make sure these clients have a diet that is high in calories, high in fat, high in protein, so that they are able to get as much as they can from what they digest and what they eat. So that is why option 2 and option 4 are correct. Talking about option 3. So option 3 was talking about increasing salt intake and fluid intake when a client is outside, when they're playing outside, probably going to be perspiring quite a bit. The reason that we want to increase not only fluid intake, which is important for everybody when you're, exercising and you're outside and it's hot, but also sodium intake. The sweat glands of somebody with cystic fibrosis, they are going to be able to sweat a normal amount, but they're going to lose that much more sodium and chloride ions than somebody who does not have cystic fibrosis. So very important to replace that sodium as well. Otherwise, if all you're doing is replacing fluid, you're going to be contributing to them developing further hyponatremia, essentially.
Yeah.
So
I think on our correct options, those 3, the biggest kind of linking factor between all of them is definitely that we are wanting to increase and maximize the intake for this client. And so making sure that they are able to get the most out of their food and their meals. We don't want to restrict them with things. We want to give them as much as they can so they can absorb as much as they can.
Absolutely. And I don't know about you, but when I was in nursing school, one of the first things I thought about with cystic fibrosis was respiratory symptoms.
100%.
Yes. And so obviously, yes, all of our correct options have to do with, digestion and some of the other parts of cystic fibrosis. When it comes to like a priority question for somebody with cystic fibrosis, it may be more important to focus on the respiratory stuff. However, let's talk about the incorrect option one, being the chest physiotherapy. And this is very important, and this is a good, test-taking option. Let's go ahead and go back to this, right? The wording on this.
Mm-hmm.
It says chest physiotherapy is administered only if respiratory symptoms worsen. What happens in the lungs with somebody who has cystic fibrosis is you get this scarring that can occur because there's chronic inflammation. There's often a lot of infection that happens as well, and a lot of tissue remodeling because, again, the lungs are going to secrete this mucus that's very thick, and it's going to irritate the airways within the lungs. So what that's going to do and what that can affect is the cilia inside the lungs. So chest physiotherapy needs to happen frequently, continuously, so that we're moving those secretions out, so we're getting them out, so that a client doesn't have worsening of respiratory symptoms.
We don't want to wait to do our chest physiotherapy until they're having respiratory symptoms or having issues with clearing secretions. We want to do it all the time to help prevent that buildup and maximize their respiratory efforts.
So just a quick test-taking tip. Again, if you're seeing these words, these items that say only, never, always, that should be a red flag in your head to take a second look about it, to reread your stem, make sure you're answering the question appropriately. And
it doesn't mean the question or the option is incorrect or incorrect. It just means you probably need to pause and kind of look at it and really evaluate what it's saying, because only, always, all of those are really just qualifying statements that are going to kind of drastically change what your options look like. So
definitely.
All right, so let's look at our last incorrect option here then.
Our last option here, so it was talking about exercise and limiting exercise to about 15 minutes a day. Something that's going to be very important for someone with cystic fibrosis is to get exercise. It's going to help expand the lungs. It's going to help build up muscle. It's going to help loosen the secretions, move them around. And so they, with proper supervision, they should be able and encouraged to exercise frequently. And so limiting to 15 minutes, that's not necessarily something you want to do, especially for a 10-year-old. A 10-year-old child, right, who wants to, obviously be out and about. So that is it for our correct and incorrect options. Again, we have our educational objective here at the bottom. We're going to take a second to take a look at some of your questions and provide maybe a few answers. I did want to show y'all another function here of the UWorld platform. So we looked at the notebook earlier, and there is another function that we have, which are flashcards. So if I go in here, let's say I really was interested in how the pancreatic enzymes, the secretion is impaired due to the blocking of the pancreatic ducts. I'm going to go ahead and create a new flashcard. And I can choose to put this on the front or the back, however I want. And I can add a quick little title. Let's see, what do I want to do? I'm going to just put cystic fibrosis and pancreas.
And we also can add some different tags down here at the bottom. So you can add the tags, and so when you're in your bank, you can search by those. So even if you don't have something in the title of it, you can still find the option you're looking for. So.
Absolutely, and you can cater that to however you like for your studying purposes. So do we have any questions coming up? Let's
see. It looks like the only one I am seeing here so far is asking about checking vital signs before we would do chest physiotherapy. So this would definitely be one, if you are working with a hospitalized client, before you do any interventions, we want to be checking our client, making sure everything is good with them before we're starting. So it does not hurt to check vital signs. But chest physiotherapy is actually going to be commonly done at home by the parent, or sometimes you can have different nurses or respiratory therapists that come work in the home, and some even have different vests they can wear that are mechanized. And so no one has to manually do the chest physiotherapy, the vest does itself. And so really on that, the important one is teaching parents how to complete it. So you as the nurse, respiratory therapist, physician, whoever is properly trained in it. And then from there, making sure that the technique's being completed appropriately. And also that, especially if it's the parent at home helping take care of this child, that they are watching for signs and symptoms, because they may not be able to take all the vital signs that we can as an inpatient nurse, but they can be watching their child for signs that they're not acting themselves or signs that they're having difficulty breathing and different things like that, and staying on top of their care plan at home.
Absolutely.
So look for any other questions.
This is very well put, yes.
Mm-hmm.
Don't ever hesitate to check vital signs, essentially. You can always check and assess before you perform an intervention.
Okay, it looks like that is the only other one I see specific to this item, so we will go ahead and go on to our third item.
Now this will actually be our last item for this review session, but we will be answering any questions at the end of this, so please feel free to ask whatever you like. Again, we like your feedback. We want to make sure we're taking more time with some of these questions. That's why we have selected 3 today, and moving forward, whatever feedback you'll have, we're more than happy to incorporate with our live sessions. So, all right, so let's go ahead and take a look at this. This is a client that has sustained a possible spinal cord injury following a motor vehicle accident. And it says, which of the following findings lead the nurse to suspect neurogenic shock? So again, when it comes to the physiological adaptation test plan, we want to be concerned about emergent conditions. And we're looking at something like neurogenic shock. That is an emergent condition, especially when it first develops. It is something that can also linger and will have its own complications. So right now, at the moment, we're in the emergency department. We really need to be thinking about what is happening at this very moment. Obviously, this is an emergent thing. So which of these option choices is going to tell us or have us suspect that this is neurogenic shock? So we'll give y'all a minute. I guess we have another poll up.
Yep, so the poll is up. Feel free to vote. And while Andrew is mentioning that, I wanted to mention here. So remember, with talking about spinal cord injuries, we've got our parasympathetic nervous system as well as our sympathetic nervous system. So parasympathetic is going to be your rest and digest, and sympathetic is going to be your fight or flight. So remember, these two are always in that counterbalance, and when you've got a spinal cord injury, you're going to have, if you will, a miscommunication on one of them where the signals can't be sent, can't be received, all those, and so they're going to be out of balance, and therefore one side is going to take over the other. So keep that in mind, and if you can remember, we're not going to tell you quite yet, but spinal cord injuries, which one does that fall into? PNS or your sympathetic? So let's see what everybody is answering here.
Take a look.
It looks like we've got 63% answering as option 1.
Okay, so let's go ahead and select that. Excellent job. Excellent job. So let's go ahead, again, take it kind of like we've been doing, right? Yeah. So we're going to start by talking a little bit about neurogenic shock and then going into the correct and incorrect option choices. So this is kind of a detailed pathway when it comes to neurogenic shock. We're not, this is something that you can peruse at your leisure. The biggest thing is when it comes to neurogenic shock, you have that disruption of the sympathetic nervous system. And that's going to lead to impaired perfusion and impaired cellular metabolism.
So you don't need to know the whole cascade, but it's kind of nice to get to see that cascade written out for you and just see how one thing leads to another there and eventually how we get to that impaired cellular metabolism. So yes.
So like Holly was saying and mentioning, with a spinal cord injury, what you have to be concerned about is developing neurogenic shock, which is a type of a distributive or vasodilatory shock. With that, what happens is there is an imbalance between the sympathetic and parasympathetic nervous system, sympathetic being fight or flight, parasympathetic being rest and digest. So let's take a look at some of these a little closer. Sympathetic is going to be very much responsible for things like bronchodilation, increase in heart rate and contractility. You're going to have your pupils dilating. Whereas the parasympathetic is nearly the opposite. Heart rate and contractility are decreasing, bronchoconstriction, pupil constriction, other things related to the entire body. When the sympathetic nervous system, the signals from it are interrupted, it's not that the parasympathetic nervous system necessarily increases its signals, it's just they are uninterrupted. They are not in communication with each other.
No longer balanced out.
Correct. So we are going to see some of these things like a decrease in heart rate and contractility. And when we see an option choice that talks about the apical heart rate, which it's dealing with the heart. We're not talking about the peripheral heart rate or anything like that. We're talking about bradycardia, and that is something that can help us characterize and we're not diagnosing, right? It's something that we can suspect that the client may be having neurogenic shock.
Yeah.
So kind of touching on what we just mentioned about that and about parasympathetic and sympathetic nervous system, the parasympathetic is going to result in vasodilation. It's going to cause a number of different complications and problems with vasodilation, including that it's going to lead to hypotension, not hypertension, which is what option 2 was. Option 2, the blood pressure was elevated. That is not something that we would suspect or see with neurogenic shock. What's that?
Can I click?
Yeah, go for it.
Okay.
Yeah, definitely.
So,
let's bring that up.
This image here, just to show you guys the difference between normal versus vasoconstriction and vasodilation. The important thing to note, and I know this tripped me up when I was in school, and so I like to talk about it now as a cardiac nurse, you are going to have an increase in your blood flow with your vasodilation, but because that diameter is so wide on your vessels, your blood pressure is going to be pretty low. There's no resistance, the blood's just kind of flowing away. And if you've got that and your heart rate is low, you're just not having enough beats per minute to really push and really perfuse. And so that's why shock becomes such an issue, because your organs, your limbs, whatever it is, are eventually just not going to get that blood. And so looking in here, obviously you've got some nice arrows for us, but it's important to note that yes, blood flow goes up, but that's not necessarily the greatest thing because it results in that low blood pressure and your low heart rate as well.
Yes, and what this is also going to contribute to, which will help us answer some of these other questions, is with neurogenic shock, because of the vasodilation, it's going to push that blood out to the periphery, right? It's going to push it out to like the fingers, the toes, and it's going to keep it there. You're going to have things like blood pooling, maybe not excessively, but it's going to keep the peripheral blood vessels.
There's not enough pumping going on to really get that blood to return back, to get that oxygen, and to go back out through the body again. It's just kind of a slow process and not moving fast enough.
So option 3 was talking about the client having cold and clammy skin. In the emergent phase of neurogenic shock, their skin is going to be warm, most likely dry to the touch, because of that vasodilation, especially to the periphery and to the skin. And then finally, option 4. So option 4 was a temperature of 100 degrees Fahrenheit or 37.8 degrees Celsius. When it comes to temperature as a vital sign and something for us to suspect a disease process, it's not going to be a defining characteristic of neurogenic shock. They're based on things like inflammation or infection or anything else that's going on. It may be possible for somebody who's experiencing neurogenic shock in the emergent phase to maybe have a low-grade fever.
Absolutely.
But we can't definitively take just the temperature and say that is suspicious for neurogenic shock.
Yeah. In this case, bradycardia would be a pretty defining characteristic of this, whereas temperature, especially in that early phase, is really not going to be something that's super defining one way or the other. So we want to go by the things that are definite, like that heart rate.
Absolutely. So I think that's, let's see, I think that's just about it from our end as far as some of the explanations go. If y'all have questions about this item, we will be taking a look here shortly and trying to answer those. The other thing, again, this is going to be, I know it's, we've already kind of come closer to the end here, but if y'all have any kind of general questions, we're going to try and field some of those as well. But we're going to start by answering any questions about this item in particular.
Especially if you guys have any questions about the subjects we've talked about today. So cystic fibrosis, diabetic ketoacidosis, or neurogenic shock here. Leave them in that comment and we'll get to them in just a minute after Andrew shows us one more thing. I think we wanted to show them about the feedback option.
Yes. So, wait.
I'll let you
no.
demonstrate.
We'll get there. Okay. It's all good. we just wanted to, again, reiterate some of the test-taking tips when it comes to some of these items.
Yeah.
So, again, we've kind of shown you a couple of different items, 2 single best and a select all that apply. However, they all kind of have different test-taking tips when it comes to what you need to be concerned about. So, again, our first one about DKA was a priority question. Most oftentimes, these questions are going to give you option choices that are all theoretically what you need to do for the client, but you need to pick which option choice is the choice that's going to keep your client alive or prevent them from developing any further complications.
The way I think of it is, which one would cause them the most harm if I didn't do it?
Correct. Our second one about cystic fibrosis. Again, it was a select all that apply. We had a couple of different taking tips on this one. First of all, again, with any select all that apply, making sure that you kind of take each question almost as a true or false and answering it individually. And then watching out for things, trigger words like only, never, or always.
And with teaching questions like this where we're getting statements from the client, the parent, whoever, we want to make sure that we are identifying what the teaching point or disease process or different aspects related to care are in that option. And then from there, looking at it and determining what the option is trying to say about said disease process, care plan, whatever it is. So like we said earlier, chest physiotherapy we identified as the subject of our first option, as it says chest physiotherapy. And then from there, figuring out when, it's asking about when do we do it. And so we need to know, are we doing it all the time? Or are we doing it when symptoms worsen? So.
Okay. And then lastly, with our neurogenic shock question, really just kind of thinking about, the nice thing about this one is, at least we're, it's kind of pointing you or pushing you in some kind of direction when it comes to thinking about a disease process, especially with neurogenic shock. So try not to read too much into the question, trying to really think back on your fundamentals, on your anatomy, physiology, and what's actually going on with the client. So.
And I always try to remember with our parasympathetic nervous system versus our sympathetic here, that we get, sorry, I'm looking at y'all's questions over here. There are so many of them. We are going to get, I'm so sorry, so it's taking forever to pull up.
No, it's all good.
So with the injury to the spinal cord, we know that their sympathetic nervous system is disrupted. And like I was talking about, that sympathetic is going to be your increased, or your visibly increased thing. So when I think about the 2 options and I think about fight or flight with sympathetic, I think of the more visible things, so like your increased heart rate, your sweating, your pupil dilation, think of like running the race. Whereas with PNS, there's a lot of important things going on, but they're not going to be as visible. So like your digestion, your metabolism, those things, obviously very important for bodily processes, but they're not going to be as more visibly outward. And so that's your rest and digest phase. So it looks like we've got some questions coming in. I'm going to answer them here. So we had a question about looking up by topics within the UWorld bank. So currently we sort by subject and system, but if you look in the test plan categories, they are scattered throughout the bank. If you're going to scroll down to the bottom of this one, Andrew, actually, I'm going to show them.
Sure.
So if you look right down here at this client need area, that is going to show you which category of the test plan it falls into. And you can look through those as you're going through our bank. But also, physiological adaptation is going to be within primarily med-surg, adult health, child health, maternal, newborn. Again, it's acute, chronic, and emergent conditions. And so that can really kind of fall into a lot of categories. If you look within the test plan that the NCSBN has created, there's kind of an initial graph or initial chart that mentions the high points, but there are some more descriptors, and it gets into things like maybe in terms of managing a disease or looking at the education we've provided and seeing if it was effective, like we had in that cystic fibrosis question. And so they're not in any one particular area for us, but they are just kind of scattered around. So,
and hopefully some of y'all had a chance to take a look at that test plan on the NCSPN's website. They do have not only the RN test plan, but they have the PN test plan as well. And physiological adaptation is something that's going to be consistent across both RN and PN test plans.
Yeah. We definitely want to point out that if you're using the UWorld platform while you're in nursing school, it can be really helpful to sort by that subject system that we have. I know when I was in school, we did our units and our tests by different body, different organ systems, different things. And so if you're really trying to study those endocrine questions or really trying to study those maternal questions, you can really hone in on those. And then even from there, I always would make tests later on of the items that I missed, because obviously I needed to go back and learn them, and tried to really spend time with those rationales, because that's really where I'm going to get my learning from, rather than just answering the question and jumping to the next one.
Absolutely.
So another question we had that I'll answer, someone was asking about septic shock in terms of blood pressure and heart rate, all of that. And so yes, your blood pressure would go down at that point and heart rate going up, depending on different fluid volume statuses, all of that. You're not always going to have your heart rate and your blood pressure moving in the same direction. So with neurogenic here, we could see that they were, but that is not going to always be the case depending on what's happening, especially if you're in shock and it's a different, or with septic shock, different stages, different points in the manifestation of that shock within the body.
Definitely, and especially, and it's obviously without being able to, we'd love to obviously pull, for future questions for y'all to cover septic shock, and so we'd be more than happy to take a look at that as far as future questions, being able to, differentiate the types of, septic shock versus cardiogenic, obstructive shock, what all those differences mean. So, but yes, like Holly said, it all depends on kind of where they're at, what kind of, how far along they are as far as infection goes, and what you're going to be doing to treat that disease process. And then
we had some questions about asking, like, where in the bank were we be able to see what our high points and low points are. And so if we want to end the test and go peek around.
Let's see, I think we just have a...
a couple more minutes here. So if you go actually to the performance tab over here, you can see some different statistics. This is our kind of fun account that we use for things. So we don't have that great of a Q-Bank score, obviously. But if you look, you can see all sorts of different stats on what you're doing. And if you scroll down as well, you can look at things. And if we go to our reports, we can also here under reports see by subject and by system how we're scoring in different areas. So it's really important, if you're like doing really great in your mental health but not in your maternal newborn, maybe go spend some more time there.
And you can get in here and actually take a look at some of the different subject matters and actually create tests in the UWorld platform that will help you focus on some of those areas that you may need a little bit more help in.
Yeah, absolutely. And I think we're also seeing, I think someone was asking about doing non-tutor mode to more mimic the NCLEX, and yes, you definitely can do that. So if you go create a test, we'll just make a, we won't actually start it in here, but tutor here, if you look at this little icon, we'll tell you exactly what's going on. So tutor is the mode we were in today, and that's going to show us the correct answer and explanation after the question. If you turn that mode off because you really are just trying to mimic your testing environment, you're not going to see all the rationales and correct answers until the end. So unless you're pretty close to your test date, or if you're trying to study while you're in school for a specific test, I would recommend using the tutor mode. I feel like that was how I got the most out of my studying, because I could really go item by item and understand it, rather than answering them all and then going back at the end and trying to find that out. So let's see what other questions we have. Somebody wanted to know about our self-assessment exams. Andrew, how many questions are on our self-assessment exams?
How many questions are on our self-assessment exams?
There are 100.
There you go.
So the UWorld self-assessments are actually really cool because we've got 2 of them. Depending on your subscription that you get, you can have none, 1, or both. And these self-assessment exams are questions that are not found anywhere else in the Q-Bank. So they're not random, they're not just pulled out of a hat. These are items that we've carefully selected to mimic the test plan in terms of how many questions you're going to get from each category and all that. And it's also a question you have not seen before in the bank, so you're not going to be skewed and get it correct or incorrect because you've seen it before. And so these are really great. A lot of people like to use one kind of at the start of their studying to help gauge where they are. And then when you're a little closer to your test date, take that second one. And I think in our comments, we've been talking about some scores and different things. We do also have an FAQ on the UWorld Nursing website that can tell you all about the test averages and scores and different things like that that you should ideally be having if that's what you will. But also important to note that UWorld is a study tool, not an assessment tool.
Absolutely.
So we want you to do well in the assessments, but we care more about you learning the material so you can take your test.
Definitely. Awesome. Very well said. Very well, absolutely great advice.
Yeah.
So I think at this point in time,
we have some time for a couple more questions.
We do?
Yeah,
Perfect.
we do.
Let's go for it.
So one other question I'm seeing is asking about where the year and the version for our questions come from and how accurate are they. So if you were looking back when we were in that test, I don't know if you want to pull it up.
Can we go back?
It would say let's resume here.
Sure. Why don't you? Yeah. There you go.
That one.
You got it.
So if you look right here, someone was pointing out where it says 2022 version. This basically is just telling you the last time we updated this question. So depending on if it's a newer item or not, you can see the year here. And yes, they are accurate. We use the same nursing textbooks that you use in school. We also use resources like UpToDate and get pretty current information that we put into our questions. And so you can always look and see the age of the question. You can see all those things. And with that, I do want to point out we spend a lot of time going through our older questions. We know UWorld Nursing started in 2015. And so we've got some questions that are 7 years old now, which that was 7 years ago, goodness. And so we spend a lot of time combing through those items that especially were from some of the beginning questions, and we've got a whole team actually dedicated to updating the sources, making sure the information's still current, and with that, going off of your feedback that you leave.
Yes.
We do read all of your comments.
We do read your comments.
Based on the feedback you give us, we help you guys and make questions better and go from there, so.
Absolutely, yeah, definitely. And I mean, what you said, since 2015, I know you mentioned that you used UWorld to get your license and to study for the NCLEX exam. That was something that I did about 4 years ago. So I know some of the older content I help use to get myself prepared and ready. But yes, we do go through our bank frequently, especially when it comes to updating.
Yes, and we know there's so many, especially you think of like CPR, BLS, ALS, those kinds of things that are changing frequently, but also just as practices and things go on. There's going to be new medications created, or maybe older medications we're not giving as often, different things. And so we want to make sure that our information is as current as possible for you guys and that you are able to get the most accurate information out of it. So.
Definitely. All right. Y'all are asking some great questions in the comments here. Fantastic job, you guys.
Someone's asking here if the questions are the same for our 30 and 60-day access, and I see we got a response there. Yes, our bank is the same regardless of your subscription. If you subscribe to NGN, the next generation items, those will come along for the test takers in April of next year. Those would be the only differences you'd see, but otherwise all subscriptions are going to have the bank items. And the self-assessments you may or may not subscribe to, but the QBank itself is going to be the same as far as all the RN items, and if you subscribe to the PN QBank, all the PN items as well.
Yes, definitely. And like you said, somebody mentioned or pulled up that there are 30 and 60-day subscriptions. We do have a variety. There's also a variety of renewals that you're able to do and participate in through the UWorld platform. So yeah, just whatever works for your study habits and your study plan for those of you that are in nursing school and want to consider using this as a guide or a help when it comes to preparing for some of your exams in nursing school, or even just feeling confident for the NCLEX. We have subscriptions all the way up to 2 years.
Yep.
So
I see a question here too about questions repeating within the bank. So we do not have any duplicate items. All of our items are unique. There may be some that are similar, especially if they're on similar subjects, but they are all unique. If you were to see a second, again, it may be a similar disease or similar thing like that. But also if you have the subscription option with the bank reset, if you reset your bank, you will see it again. But otherwise, all of our items are unique. We do not have anything in terms of subscriptions that is going to repeat. Now, obviously, if you're using the learning platform with your school versus your private study, there could always be crossover, but we do have obviously specific items for that too, so your professors can avoid that. Another question on self-assessment exams, just asking about timing. And so, at least what I did, and I don't know if you did this as well, to asking when to take them. So definitely take it at the beginning, I think, of your studying to kind of gauge where you are, gauge where your strengths and weaknesses are in terms of subjects, then really go focus on those subjects that you were not doing as well in. And then from there, usually a week or two out from testing, kind of depends on how soon you're testing. I know I took mine pretty quickly because I was ready to just get it done. But take that second one, and then that can help you have a good predictor, and then leave a little bit of time so you still have some review time for it. So.
And I think that's, obviously, when you took it, those self-assessment exams were, there and present, ready. I can't recall 4 years ago how or, what we were doing as far as the self-assessment exams, but even just getting in and, making or generating a 75-question test and just kind of repetition and practicing maybe once a day, trying to do that, or it really just depends on, your study habits, what you like to do. Try not to, stress yourself out too much.
Somebody said in the comments earlier they were burnt out. Please don't burn yourself out.
Yes, please.
I know for me, I was much more of I would make a 10-question set, study, and then a couple hours later maybe can do some more. I could not do the sit down and go through it all. So please don't burn yourself out. But also if you are, just take your test soon, and we believe in you, and it'll all be done then. So.
Well, and you bring up a good point with the 10-question set. With our app, I think that's a great way to get in, do a quick little exam, or 10 questions on your phone.
Yeah.
Whether you're sitting before an exam or what have you, whether you're studying, just a quick little break, just kind of learn a little bit, see where you're at.
Yeah. Absolutely.
As far as the mobile phone functionality.
Yeah, I was gonna say that's a great one that I was trying to work when I was prepping for my test, and so whenever I had a break here and there, I'd pull up the app and use my subscription login, and I could take some questions, and everything would carry over. So I'm seeing a couple more things. Still some more questions about how many questions to do. Again, on our FAQ page, we do have, there's a couple links there about study plans that I would suggest go looking at. One was someone's personal study plan they had, and then one is our suggested based on the number of items in the bank. And so we really don't recommend doing more than 20 at a time. You're just gonna fry your brain. Just gonna be stressed, especially if you are really looking through those rationales. Yeah. If you're doing your self-assessment, obviously take your assessment. But if you are really sitting down and studying through the rationales and the items, don't do more than 20 because you're gonna be overloaded. But on that, someone's asking also about accessing rationales in the self-assessment questions. Yes, this would be at the end of it. So in the same way that when you're in the bank here, doing tutor versus the regular or versus the test mode, that's just in test mode, and so you're going to see all of your rationales at the end, and definitely spend time on those. And it looks like I see 2 more questions about some actual content.
Oh, wonderful.
So somebody wanted to ask about insulins that we should focus on for the test. So I know that's a little specific, but we can at least talk generally with that.
Yeah, I mean, it's kind of broad, but I mean, at least in the context of physiological adaptation, I think it's a good point. So, one of the things that I would think that you're going to see quite a bit of is going to be the rapid-acting insulin. As far as test taking and what you need to be proficient in to be a safe practicing nurse, is making sure that you're not going to administer something that's going to harm the client. Yep. And so something like a rapid-acting insulin, at least in clinical practice, something that we sign off on daily, and we have to make sure that, somebody else is there to double check and make sure that it's the right, dosage, and that we've checked the blood sugar and it's recent, it's current. I would definitely say, any kind of rapid-acting insulin is going to be one to focus on for sure. I
would definitely focus on your rapid-acting, intermediate, short, and long-acting. Really which is all of them. But the biggest thing is within each category, know those main features. So what is your onset? How long does it take for that to actually hit the client? when are they going to peak, and how long is the duration of that insulin. And so, a question may be asking between different kinds, and you need to be able to sort out which is which. And then also things like sliding scale is loved to be asked about, and taking the blood sugar, determining the dosage. I know you may see some questions sometimes about insulin mixing, so knowing your rules on there of what can be mixed in a syringe, and especially which one is first, all of those. And I think with insulin too, I know a big one I kept seeing was just specific to the administration in terms of sub-Q, all of that. And so I don't think I'm going to give any overly specific on the insulin parts here, but just knowing, kind of knowing generally your types of insulins, and then just those basic details about them. And like Andrew said, just making sure that when you're taking your test, you are not doing anything, don't do anything unsafe. And so, if their blood sugar's low, we're probably not going to give a whole bunch of rapid-acting insulin, those kinds of things. So
definitely. Absolutely. Good question.
And last one, I see someone was asking about, I'm going to guess this is in relation to a specific question, talking about when we're giving oxygen to a client that, are we notifying the doctor first? Are we giving the oxygen? What are we doing here? And just kind of wanted to point out that in our questions, and not just our questions, but on the NCLEX, if that is an option, if give oxygen is an option, regardless, or if anything is an option, you have the order. So, I can't speak to whatever specific question was being asked about, but just in general, please remember, if there is an option listed, you have an order for it. So if it's initiating a medication, if it is completing a task or anything like that, you have the order. You do not need to go and ask for it. Now, obviously, there are going to be questions about clarifying prescriptions, those kinds of things, but the rule of thumb in the NCLEX world is you have the order and you have what you need to complete the order. So, I think our last one that we're going to answer, someone's asking if we could do more questions on the next live session. They found it very helpful. Thank you. We hope you did. We definitely want your feedback for next time, so we are going to keep doing these. So let us know in terms of questions what subjects you guys are wanting, maybe especially specific diseases or organ systems. And, do you like more? Do you like less questions? What are you looking for us to help you with? We want to not just go through the items and not just say this is right, this is wrong. We want to help you understand the why behind it, and really, let us helping you with these 3 questions help you with your other test taking and your other questions, so you can apply strategies and tips, and also just general knowledge that we can help provide to you.
And while we can't obviously, get to everyone and make sure that we're answering specific questions for every single person, hopefully some of our test-taking tips and some of the things that we're pointing out to you when it comes to some of these disease processes are going to help you moving forward in your test-taking. So
we're about to wrap up, but if you would like to, go ahead and drop in the chat maybe some of those areas that you are needing the help in, that you feel like you're not performing as well in, or maybe that you just are like, I am so confused on this topic or category. And we will try to implement those into our next ones.
Absolutely. And our next live section is going to be next Wednesday, same time, 2 p.m. Central. And we'll be covering questions over psychosocial integrity.
So we've gone over those tips. You guys had a lot of questions today. I was very happy about that.
Nice, yeah.
So also want to let you guys know that because last week's live was so popular, and hopefully this week was too, we have actually created another YouTube channel for YouTube Nursing. This will be put in the comments for you guys, so please subscribe there. Our future lives will be there, as well as the postings from this week and last week. This week and last week's will still live on the main channel. Don't worry, they're not going anywhere. But for the future, we're going to put all of our nursing content there, so you guys can really just have a whole channel devoted to all that. So please subscribe to that. I guess ring the little bell for your notifications, all of those good things. But again, like Andrew said, 2 p.m. Central Time, important on Central there. We will be back next Wednesday, and we will be covering those psychosocial integrity items. So all of your mental health questions, bring to us. We will help you out. And lastly, would you like to remind them just about our subscriptions before we head?
Yes, just real quick again, kind of like we already talked about, but there's 30, 60, 90-day subscriptions. For those of you who are taking your NCLEX here very shortly, might want to just jump in and get a little extra studying in. And like I said, for those of you who may be in nursing school and may want something a little longer, we offer subscriptions up to 2 years with renewals for all of them. So
that's all we've got for you guys. Thank you so much. Oh, I see SATA coming in. All right, understood. Understood. So that's all we've got for you guys today. Thank you again for joining us. We were having a lot of fun bringing these to you and really enjoying getting to showcase some of our items. So until next week, happy studying.
Happy studying.
Bye, guys.
Thank y'all.